One of the side effects, Dr. Brett Bolton is here. Doctor, welcome in. Thank you for being here.
Hi, thank you so much for having me.
So I hear, like I said, a lot of good news stories from people, having great success with this. But one of the things that's starting to pop up now is, are you losing your hair? And I was talking with Mackenzie, and she goes, when I started these shots, I was getting clumps of hair out of my head in the shower. And I might be noticing that maybe things are a little thinner on top. Now, I don't know if that's because I'm in my 60s and it just comes with age, male pattern baldness, but I still have a decent head of hair, but it does seem a bit thinner. What's going on with these shots related to hair loss?
Okay, so there's a couple of things happening. So first off, it may not have any effect at all as far as hair loss is concerned for some patients, but some patients might get a little temporary hair loss. It's called the hair shock, where it's just basically a shock to the system where they temporarily go into a resting phase, and a lot of times that hair will just return over time. Usually if it's a good hair, meaning it's not meant to fall out, it will return once it comes out of that dormancy phase. Now, unfortunately, a lot of patients will have hair that's on its way out. That's what's called the catagen phase. It's in its death phase. If you have hair in that phase and then you have that hair loss shock, that hair may not return. So there is good news and there's bad news with it. But definitely overall, it's going to come back.
All right, let's talk about solutions for people that are going through this. Alopecia is obviously a condition where people really lose their hair. But if it's just, when you're a doctor that works with hair transplants, before you get to that stage, what are the compounds that people can use on their hair that they're like Rogaine? What is the active ingredient that I'm trying to get to, and does that really work?
So yes, there's 2 FDA-approved treatments that are currently out there. My number one go-to is, the brand name is Propecia. The ingredient is finasteride. So finasteride 1 milligram is very effective. We know about it for over 50 plus years. It was originally a prostate medication in a 5 milligram tablet. Then we figured out it was keeping the hair on patient's head. So then they switched it to a 1 milligram tablet, and that came out in about the 90s, and that turned generic. And so now we take a 1 milligram finasteride tablet a day, and it helps to prevent future hair loss. That's one of the effective ways. The other one is minoxidil, better known as Rogaine. Everyone knows about that one. They got male and female versions of it. It's the same product. One's 2%, one's 5%. And we always start everyone off with the lower percentage in order to see how their body adjusts to it. So I have my men use the female one because I want to get them adjusted to that initial dose. And then after they use it for about a month or so, as long as there's no irritation or redness or flakiness or anything that looks different to them on their scalp, then they can go up to the stronger percentage, which is called male 5%. Very effective. Also works differently than the finasteride. The 2 of them together are a great combination to help prevent future hair loss.
So what is it actually doing? Waking up sleepy hair follicle roots? I mean, what's the deal?
Oh, great question. So the finasteride is directly stopping the genetic process that's causing our hair loss. So as men, what happens, we have a genetic hormone that's taking place where the testosterone in our body is converting into something called DHT. When that DHT builds up, it causes a mucousy secretion to build up that will miniaturize the hair follicles, and then that keeps the hair from making its way through. So what the finasteride does is it helps to block that conversion of that testosterone converting into the DHT. So that's how that one's working. The minoxidil is a vasodilator. So what that means is it's opening up the blood vessels that allows more minerals and nutrients and all the oxygen to go where it needs to go to make a better environment for those little miniaturized hairs to make their way through. So they work differently, but they're both effective. If I can talk the patient into using both, that's always the best. If they're picking either one or the other, the finasteride is going to be the easier, more effective way to go.
Any major side effects with either?
So I hate to even tell the patients about the side effects because as soon as I say it, they immediately freak out. But there is a percentage or 2 of the guys that will have a decreased sexual libido with the finasteride. It's very rare they have it. It was more common when we were giving the 5 milligram tablet, which was for the prostate, and the patients were cutting it. That was affecting the absorption of the pill, and we were seeing a lot more side effects with that. Once we went to the 1 milligram, it's really not that common for the patients to get the side effects, but I do have to warn everybody about it because I never know who the lucky guy is, and I want to make sure everyone, has the information before they take it. The minoxidil, the side effects, because it was a blood pressure medication, could be little things like heart palpitations. You might feel like your heart's racing a little bit. That's usually the most common one with that. And unfortunately, a lot of doctors today are prescribing minoxidil orally, because it was originally a blood pressure medication and it's easier for the patients to take the pill, but then we see more side effects. So I definitely don't recommend the minoxidil orally. I always recommend that as a topical. And for sure, I
less of
the patients. Yeah, go ahead.
Less of an effect then if it's a topical versus the pill of minoxidil. You don't feel the heart racing.
Yeah. You'll have a chance of the side effects, and it's more effective when it's used topically.
Okay.
Because it gets right to the area,
Yeah, you're right. The disclaimers on these pharmaceutical ads on television may cause a rash, redness, or even death in some patients. It's like, what? Who's signing up for this stuff? Sure, give me the prescription, doc. Yeah. Well, I really appreciate the insight, Dr. Brett Bolton. Thank you so much. We'll do it again soon. No doubt about that.